Hello everyone. Today we are going to discuss about lymphedema, which occurs due to the failure of the lymphatic system. This lymphatic system serves to carry the fluids to the body part. They are like blood vessels which carry the nutrients to the different body organs. So we'll see what are the parts of lymphatic system. So this mainly involves lymph vessels, lymph nodes, spleen, thymus gland, tonsils, lymphocytes. So these are the parts of the lymphatic system. Now we'll see the functions they are serving. So the functions of lymphatic system are transports protein and fluid from the tissues to cardiovascular system, transports fat from intestinal lymph vessels to cardiovascular system, has important immunological functions. So it serves like a blood vessels. Instead of blood, it carries the nutritious element to the cardiovascular system, then carries fat to the cardiovascular system and has an immunological functions, that is, it provides the immunity to the person. Now we'll see what is lymphedema. Lymphedema is the swelling of the body parts, most often arms, legs, as a result of lymphatic failure. So it occurs due to the failure of the lymphatic system, and mainly the extremities get swollen up. It is an abnormal accumulation of proteins in the body tissue, and over the period lymphedema causes tissue proliferation of the affected area. So in this condition the proteins get accumulated in your extremities, and mainly due to the accumulation of those parts the body get swollen up. So this is what lymphedema means. Types of lymphedema, there are two types: primary lymphedema and secondary lymphedema. That means primary means it occurs due to the failure of the lymphatic system. Then secondary means it has secondary factors, like it can be trauma, it can be other disease conditions and so on. So in primary lymphedema, born with insufficient or compromised lymphatic system, that is something disturbance in the lymphatic system. Then secondary lymphedema may be result of surgery and or radiation for cancer, then filariasis, trauma, infection, chronic venous insufficiency or obesity. So these are the secondary reasons that can lead to the lymphedema. Then symptoms of lymphedema, how you can notice: swelling starts gradually and may be preceded by a feeling of heaviness or fullness in the affected area. Rings, bracelets, clothing or watchman may feel tighter than normal. Pitting edema, decreased range of motion or mobility, recurrent cellulitis infection. So mainly in this condition the body gets swollen up, and so you will be feeling tightening in the area where there is edema formation. Then early detection is to have a check, and that can be done by educating the persons. Then specialized clinicians diagnosis. On the basis of the diagnosis you can find out the disease condition. Then early assessment of unilateral UE lymphedema with use of LDEX. So machine can be used to identify. Then patient's weight can be checked to identify the condition. Then you can go for the management. In management, complete decongestive therapy CDT as a method of choice includes two-phase: decongestion phase and maintenance phase. Blue indicates phase 1 intensive phase, green indicates phase 2 maintenance phase. So decongestion means we try to treat the congestion what is formed due to the lymph edema. Then we can go for the maintenance. This is maintenance in the diet and other symptoms that can cause lymphedema in the patients. So in today's class we have seen about the lymphedema, then we have seen the parts, that is anatomical features, system that involves in the lymphatic system. Then we have seen the functions of the lymphatic system, that it serves to carry fluid and proteins to the through the tissues to the cardiovascular system, then transports the fat and has an immunological functions. And we have seen the definition, that is lymphedema is nothing but the swelling of the body parts, most often the arms, legs, that results due to the abnormal accumulation of the proteins. Then we have seen the types, which mainly includes the two types: primary lymphedema and secondary lymphedema. Then the second one is then we have seen the signs and symptoms, that mainly involves the swelling of the body parts. Then diagnostic procedures involves the health education. Then LDEX machine is used. Then patient itself get consciously test himself as the weight is increasing and the body parts is getting tightened. Then we have seen the management, which mainly involves the complete decongestive therapy, decongestion phase and maintenance phase. So that's all for the today's class. Thank you to all the students.